You have stretched it, iced it, maybe massaged it. Maybe someone even worked directly on the sore spot. And the second you reach overhead, that same pinch comes right back in your shoulder or your shoulder blade area. Here's the thing nobody tells you about. The problem might not be your shoulder. You might feel it during a bench press, an overhead press, or a pull-up. You might feel it putting on a jacket or reaching just into the back seat of your car. And naturally, you assume the problem must be inside my shoulder. But what if the shoulder isn't the only place you should be looking? What if the painful area is working overtime because another part of the body isn't contributing? Pure overcompensation. For many people, that missing contributor is thoracic spine, the section of your spine that runs in between your neck and your mid-back area. So today in this video, I'll show you how your stiff mid-back can change how your shoulder blade can move. Why treating only the painful shoulder can fail to create lasting change, and how a few specific drills can improve the whole system. By the end of this video, you will be able to test it on yourself under 60 seconds and know exactly what drills to do and what stabilization exercises to do for it. And in the end, I'm going to share with you guys a 8-minute everyday routine. So why mid-back? Your shoulder isn't alone. Most people think of a shoulder as an isolated joint. It isn't. Raising your arm is a team effort. Arm bone, shoulder blade, collarbone, rib cage, mid-back, everything is moving together. The shoulder blade doesn't float on its own. It glides across the rib cage as your arm goes up and down. Think of it like a door on a crooked frame. The door can still open, but it has to fight the frame to do it every time it opens. If your mid-back is stiff, your shoulder still gets the job done just by fighting for it. You shrug, you arch your back, you drift your shoulder into the spot where it feels pinchy, and it hurts. That's why rubbing, icing, stretching just a sore spot can feel like chasing the symptoms instead of fixing what actually is making the pinch. So the real question isn't where does it hurt? It is what's the rest of the body is doing when it hurts? So what is your mid-back's role? Your thoracic spine is built to do two things: extend and rotate. Extension takes you out of a rounded position and lift your chest up. Rotation lets you turn through the rib cage instead of forcing all the movement from your neck, from your shoulder blades, or from your lower back. Picture someone sitting at a laptop for 8 or 10 hours. Head drifts forward, upper back stays rounded, rib stays compressed, arm stays in front of the body all day. The posture isn't inherently dangerous. There's no such thing. Not a single posture is a dangerous posture. It's the amount of time you're spending in that single posture. But now imagine the same person sitting in front of the computer for that long goes to the gym and tries to press overhead. Suddenly the body needs thoracic extension, ribcage movement, scapular rotations, shoulder strength and control all at once, but the mid-back barely moves throughout the day. So the body finds another compensations to do that, another ways to do that. Ribs flare, lower back overextends, shoulder shrugs towards the ear, arm drifts forward, and then there comes that familiar pinch. So the key point here is the goal isn't to stop treating the shoulder. It's to stop treating the shoulder like it exists by itself. So let's find out that's true for you or not with a test that you can do right now in under 30 seconds. So stand up with me and let's do this 30-second test together. So you're gonna stand normally like you usually do and lift your arm up, the painful one of course, and go as far as you can go. Now, wherever it stops you, wherever you feel the pinch, try to hold that position and ask yourself 3 questions. Number 1, on a scale of 0 to 10, how bad is my pain? Let's say 8 out of 10. Then number 2, was the movement smooth or restricted? Of course, in my case it is restricted. And number 3, what range you felt that pinch? Maybe let's say at 120 degrees. Now bring your arm back down, maybe with the support or without the support. Now try to stand tall. Imagine a plumb line extending you from top of your head and just try to extend. Don't try to squeeze back your shoulder blades too much. Just try to extend. Make sure it's not painful for you, right? So what you want to do is you're going to squeeze back the shoulder blades, bring your arm up now keep your shoulder blade back here. So you're going to extend your mid back, bring it up, and see if you're able to go little high, or if your pain became 7 out of 10 from 8 out of 10, or if the movement became little smooth. Yes, no, it remained the same. All three things tells us something. So if you notice a clear improvement, you might want to correlate your mid back to your pinch and do some drills that I'm going to discuss in this video. If there is no change at all, then it's okay. It could be something else. Or if it got worse, why not we seek professional help, right? So, but just remember, this is just a test. It's not a diagnosis. There could be some other things that can be related to your pinch as well. But what I have seen in most of my patients, their mid-back mobility plays really important role in their shoulder pinch, shoulder rehab. It's a good contributing factor. Moving forward, we are going to discuss 3 mobility exercises of thoracic spine and 1 rotation. And then we are going to learn, after the mobility, how we can stabilize our shoulders there with 1 simple exercise. So let's start our first exercise. Our first exercise is the very first component of our mid back, that is our thoracic spine. Remember, we did discuss about the thoracic extension and rotation. So today, first exercise would be about the thoracic extension. Let's start. So what you're going to do, you're going to sit on a chair, your feet flat on the ground. Make sure the chair is not too high. It should come across your mid back area. Now you can place your hands either here or you can place it back in here, and you're going to extend backwards. Now you want to make sure that you're extending from your mid back area, not from your lower back. So don't arch your back like that, or don't drop your neck like that. What you're going to do simply is extend, flare up your rib cage, squeeze back your shoulder blades and extend. You can do the same thing while you're doing from the front and extend, and you can maintain that position for 5 to 6 seconds or as your pain allows you, and you can do the same exercise for 6 to 7 times. Let's move on to our exercise number 2. Foam roller extension drills. We are going to foam roll our back. Now if you don't have a foam roller, you don't have to worry about it. Either you can get a foam roller or you can place a stack of pillows here and you can lie on it for some time. If not, use the foam roller or skip this exercise. Now you are going to go on a floor, place this foam roller around your mid back area, and you are going to slowly and carefully lie on top of it like that. Now you can either place your hand like this or like this again. Now what you're going to do, you are going to foam roll it nice and easy. Yeah, that's relaxing. I can already feel some cracking, which is good. And in the end, you can just lie down like this and let it extend. Wonderful. And you can come on back up. Some people like to hold the extended position for 2 or 3 seconds. You might hear few bone crackings in there. That's completely normal, completely fine. And if you find your roller to be little hard on yourself, just cover it with a towel. So with that, let's move on to a third drill that improves our rotation. So it's called open book rotation drill. Hey, I'm here. So for the next exercise, we are going to sleep. Not really. So what you're going to do, you're going to be on your side. You can be on your painful side if you can. Otherwise, you can be on your good side. I've placed a towel roll underneath my neck, but it is optional. So you're going to bend your knees and bring the upper leg little forward. Place your hand in here. So traditionally, we used to flare up our hand like this, which is not wrong. It is a good practice. But usually what happens when we do that, we bring our hand so much down that the movement is coming mainly from our hand and not from our shoulder blade. So you can place your hand right in here and squeeze back the shoulder blade. The aim is not to touch the shoulder blade back. The aim here is to go as far as you can under pain-free range of motion. You can do the same thing with the arm open or arm closed. But the idea is to squeeze back that shoulder blade. Try not to push through it. It should be pain-free. Remember that. And you go, hold that for 5, 4, 3, 2, 1. And you come back and you can repeat it for 5 to 6 times. After this drill, you can stand and retest your arm raise. Has the range changed? Does the shoulder feel less guarded? Immediate change does not guarantee you have found the whole cause, but it identifies that something has to be done at the mid-back to recover from shoulder pain. Let's move on to our last drill, which is rebuilding the shoulder control. So let's start our fourth and final exercise, which is our scapular stabilization exercise. We talked a lot about mobility, now let's stabilize it. For the shooting purposes, I'm going to use my door as a wall because I'm at my home. So what you're going to do, we are going to do it without the band first, and then if you want, you can use the band if your shoulder allows you or if you have a band. So you're going to place your hands like this right in front of you. If it is not painful, or you can go a little down if that is not painful. You can stand closer to the wall and you are going to press onto the wall. As you slide up your hands, you can go straight or you can go to the Y direction like this while pressing onto the wall. When you do that, go as far as your pain allows you and try to keep your shoulder blades back, but don't squeeze them back too much because they need forward motion to bring your hands up, but just keep them back a little bit. Don't squeeze them down. So keeping them up, and you hold that for 5 seconds and you bring down. You can do the same thing with the band. You can put the band around your wrist. So I just tied the knot around my band, and you can do the same thing. You can go up and you can feel it in your shoulder blades already. So just make sure the shoulder is not coming forward like this. It is squeezed back, but don't squeeze it back and down. And let it rotate upward. Feel the upward rotation as you go up. And just make sure, like with all the exercises, it should be in a pain-free range. How did that go? You can always pause the video and do these drills on you. Let's put it together for 8-minute routine. Start with the chair extension drill, 6 slow reps. Move to the foam roller extension, 2 positions, 5 controlled reps or 1 rep. And finish with the open book exercise for 5 to 6 reps, 10-second hold, and you can do a scapular stabilization towards the end on the wall, 5 reps, 10-second hold. Remember, you're looking for a trend over time. If the movement is getting easier, is the painful range getting smaller, is your confidence increasing with the movement, can you do more without symptoms flaring upwards? Don't judge it on the dramatic crack or one good day. Look for repeatable improvement. Before you go and do this routine and close this tab, you can check the link below in the description box or the pinned comment where I have done this 8-minute routine that has helped me immensely to increase my weights for the shoulder and to reduce the pinch that I used to feel in my left shoulder. Get assessed if your pain started from a major fall. Suddenly you can't lift the arm, especially after the injury. You're feeling numbness, tingliness, or your arm is getting numb, or your hand is getting cold, it is turning blue. You need to have a professional help rather than trying any assessment or any exercises present online. Also get the professional guidance if the pain repeatedly wakes you up, blocks you from normal daily activity no matter what you have tried for it, or isn't improving over several weeks. Then you might end up needing more radiological investigations, maybe a proper rehab plan. So in this video, let's conclude. We have learned how your mid-back can influence your shoulder, what drills you can do to improve it, how you can test it on yourself under 30 seconds if it is the contributing factor. But apart from that, there are so many other things that helps you in moving better day-to-day life. For example, taking frequent breaks. Every 20 minutes, try to stand up and move around. You want to focus on overall mobility of your body and not just the part of it. So you want to make sure that you are moving your mid back, your upper back all the way long throughout the day, and not just for an 8-minute mobility. But if you have a sitting job, you can do simple extensions, you can do simple rotations, you can move your shoulder blades, and stop thinking of the shoulder as an isolated piece of hardware. It's part of a connected movement system. Sometimes the location of pain is the main problem. Sometimes it's the area compensating a problem from somewhere else. Sometimes both are true at once. That is the reason why if it is not getting better, you need a professional help. Your job isn't to chase one perfect explanation. Your job is to test, observe, adjust, and build capacity. Restore the movement your mid-back has lost. Teach the shoulder blade to use it. Strengthen the shoulder itself, then gradually return to what you actually want to do. I hope this helped you. Comment your problems down below and I'll try to answer your questions. And if you want more such videos on shoulder or any other body part, do let me know. If you like this video, you can also check out the video I have posted before for tear and impingement of your shoulder. So click, subscribe, like and comment.